Dear students, welcome back. In the previous session, we have discussed about introduction to the vertebral column biomechanics. Now, in this session, we are going to discuss about the general structure of the vertebral column. So, the structure of the vertebral column consists of 33 short bones called as vertebrae. So, from top to bottom here you can see it is called as vertebral column and it is made up of with 33 short bones called vertebrae, and it resembles as a curved rod. And this vertebral column is divided into 5 regions. One is the cervical region, next one is the thoracic region, and next is lumbar region, sacral and coccyx. Here you can differentiate the thing. So this one is the cervical, thoracic, lumbar, sacral and coccygeal regions. And in these regions, the vertebrae, all the vertebrae attached to a common basic structural design. But all these show some regional variations. So the vertebrae which are present in one region is not same as that of in the other region. It shows some variations from region to region. So the variations are change in the size of the vertebrae and also the number, that is the configuration of the vertebrae, are different in each regions. Okay, if you see the size of the vertebrae from cervical to coccyx, so the size of the vertebrae is going to increases. From cervical to lumbar region, and then it is going to decrease from sacrum to coccyx. Why such thing is happening here? And also if you see the number also, the number of vertebrae which is present in the cervical region is only 7, in thoracic 12, lumbar 5, sacrum 5 and coccygeal 5, totally 33. So each region is also having different numbers. So why such variations are present? So because these regional variations are used to meet the functional demands of that particular region. For example, if you say the cervical region, so it consists of 7 cervical vertebrae. So the main function of this cervical region is to hold the head, okay, and also helps in the movements of the neck. So for these two functions, the 7 cervical vertebrae is enough. Okay. So if you see the thoracic region, the function is going to change, because at the level of thoracic region, the thoracic vertebrae, not only it is having mobility, it is having some additional attachments called as ribs, which gives protection to the internal organs, isn't it? For that reason, the number of vertebrae is more, and also the size of the vertebrae is also going to increase when it is coming down, because at the level of lumbar region, so this is the only skeletal part at this part of the trunk. So in this lumbar region, there is no other attachment of bones, isn't it? Only this one. So the size of the body is greater when compared to the cervical thoracic, isn't it? So for that, each and every region has some peculiar or particular functions which are different from other regions. For that reasons, so the size and the number of vertebrae are different. Okay. So out of 33, 24 vertebrae are mobile, and they are free to move from one over the other, whereas the remaining 9, that is in the sacrum and coccyx, the vertebrae are fused. Okay, and these 24 vertebrae also, each one is a different or a separate entity or division in the vertebral column. Okay, now so this is about the general structure of the vertebral column, and in between each vertebrae we'll find the intervertebral disc. In between two vertebrae we can find the intervertebral disc. How many intervertebral discs? We are having 23 intervertebral discs, because the remaining 9 vertebrae are fused, so we can find only 23 intervertebral discs. Okay, now we will move on to the another important thing, that is curves of the vertebral column. So if you see the vertebral column in the posterior view, so the vertebral column does not show any curves when we see in the posterior aspect, and it forms a straight line and bisects the trunk in the frontal plane, If we see the vertebral column, the lateral view or sagittal plane, we find some curves. So, how many curves are present in an adult vertebral column and how these curves are formed, now we will see. Yes. So, this one is the adult one. So, adult one is having 4 anteroposterior curvatures, anterior and posterior curvature. So the side, if you can see, this one is the anterior side of the vertebral column and this one is the posterior side. Okay, so the curves of the vertebral column is of 2 types. One is primary curves and the secondary curves. So the primary curve is present from the birth of the baby throughout the life, that is called as primary curve. So this primary curve is a long curve which is convex posteriorly, which we can see at the birth. Now this primary curves will retain throughout the life in 2 regions. One is at the thoracic region and another one is at the sacral region. What is the primary curve? Posterior convexity. Posterior convexity we can find in the thoracic and at the sacrum regions. Okay, and the remaining secondary curves, that is another 2 curves, are formed during infancy period. Okay, and finally in the adult we can find 4 curves. Okay, what are the 2 secondary curves? So the 2 secondary curves we can see at the cervical region and the lumbar region. So what is the secondary curves? So anterior convexity of the vertebral column is called as secondary curve. So how it is formed? These curves are formed during infancy period. Okay, and these secondary curves are named as superior secondary curve, so that is at the cervical region, and inferior secondary curve, which is present at the lumbar region. So here we can find the superior secondary curve. Yes, superior secondary curve is formed when the baby begins to hold his head against the gravity, then the superior secondary curve is formed. So normally the infancy period is from birth to that is 0 to from birth to 12 months. This thing will happen. The superior secondary curve is formed at the age of 3 to 4 months, and the inferior secondary curve is formed when the baby begins to stand and hold the trunk upright. So normally it takes at the time of 10 to 12 months after birth. So these are the secondary curves which are formed in the infancy. Okay, so these are all the primary curvatures and secondary curvatures of the vertebral column. And the primary curvatures are given a name called as kyphotic curvatures. So this thoracic and sacral primary curvatures are called as kyphotic curves. What do you call? Kyphotic curves. And the cervical and lumbar secondary curves are called as lordotic curves. What do you call? Lordotic curves. So what is the use of such kind of curved column? Because the curved vertebral column provides a significant advantage over a straight rod. In the case of to resist much higher compressive loads. So the curved one can resist higher compressive loads when compared to straight rod. Okay, normally according to Kapanji, so one of the researcher, a spinal column with a normal lumbar. So this is the normal lumbar, cervical and the thoracic curvatures has a tenfold ability to resist the axial compression in comparison with the straight rod. So this is the one of the advantage of this curved vertebral column. Okay, and another important thing we have to keep it in mind. So these curves are interdependent. The curves are interdependent, and the head is balanced over the sacrum through this column. Okay, and the region between the head and the pelvis acts as an closed kinematic chain. Changes in any position of any one segment will result in changes in the position of adjacent segment or inferior segment. For example, if there is a change in one of the segment of lumbar region, so it causes changes in the adjacent superior segment as well as adjacent inferior segment. So to understand this thing, what do you mean by a segment in the vertebral column? So is the segment is a single vertebrae or a pair of vertebrae? That is the thing you have to understand. Okay, normally a segment is called as the mobile segment, which is the smallest functional unit in the spine. So that mobile segment we are going to discuss in the next video. And what is it's important? Why should we understand this mobile segment? Okay. So what is its importance in clinical practice? Those things we are going to discuss in the next video. Thank you.